Morning, everyone. Welcome to Healing by Hands. Today we're going to be going over self-treatment after you've had surgery to have breast tissue removal or breast augmentation removal due to cancer or inflammation. So I ask that you wait the 6 to 12 weeks to let your body heal up. Usually they don't want you moving your arms around too much afterwards because you could get pooling inside the little cavities where like the breast tissue or the breast implants used to be. So, and I recommend that you work with a health professional that teaches you how to do this in person, and just using this as a guide and a tool in case you have forgotten how to do the treatment at home. So we're going to start off with just locating where your sternum is, like right in the center of the chest, and then you have your clavicle. So you have lymph nodes above and below. A lot of times with the removal of breast tissue, they will remove the axillary nodes underneath the armpit. So you'll get this pooling in the forearm or the upper arm here. So we want to move fluid out of these areas and keep it consistently moving. So I'll go over some exercises too, as well as the other treatments. So one thing that I recommend is a bristle brush for body brushing. So this will help to stimulate the lymphatic system. Again, we're not going to use this over any recent surgical sites, and we're going to be very gentle, and we're just going to do light circles. So we would start with this treatment around on the chest and above the clavicle, and just doing some light circles. So I'm just going to slide this down so you could see better. So we're just doing light circles around here. You can come up onto the shoulder. And then we're on the deltoid muscle, the shoulder here. So we're just circling around to the back. You can even do a little bit on the back of the shoulder too as well. Just circling, coming down, and coming down the inside of the arm. Once you've done some circles, then we could just do some straight brushing, just stroking down, coming back across the chest. Again, everything needs to be very light. Your lymph nodes are about the size of a pea, and any pressure on that is not going to allow fluid to flow out of it. So we're just creating the fluid to become more like in a water state than a gel state. So to the back of the arm. Okay, so coming back to those circles around the elbow. Good. And brushing down. And you can get these brushes at like Bath and Body Works or the Body Shop. I see them especially around the holiday times. So we come down to the hand, just light brushing. So now we're going to work our way up. So just gentle strokes coming up towards the heart, starting at the top of the arm, because we're trying to decongest the bottom of the arm. So we want to start by loosening up any traffic jam that's in the upper part of the arm and then slowly flushing it. So again, coming back up the arm. And I'm just going to do one side of the body for demonstrations, but you can do the same thing on the other side. So again, coming down to the forearm, brushing up. Perfect. Okay, so from here, we're going to start the massage portion of the lymphatic drainage. So we don't want any oil in the skin, and we're producing more of a stretch on the skin than putting pressure. We don't want to apply pressure. So imagine that you have a delicate pea in your hand. You don't want to push on it because it's going to squish out. So we just want to provide a stretch in the skin. So we're going to start where that little sternum bone is and we feel our ribs. So just start right here and we're just going to pull down in this direction. So just lightly placing your hand onto your chest and pull and feel the stretch in the skin. And then release. And again, pull and stretch the skin. And pull and stretch the skin. Okay, so we're going to pause for a moment and we're going to just focus on our breathing, because anytime we could do belly breathing, that helps things to drain too. So take a nice deep breath into your abdomen and exhale, relaxing the shoulders. And again, inhale and exhale. Okay, so coming back to the pull the skin and release and move across, pull the skin and release and work your way across, pull the skin down and release and pull the skin down and release. Good. And come back again, pull the skin down and release, pull the skin down and release. Again, no pressure, just pulling the skin. Okay, so now we're going to come above the clavicle or the collarbone here. So just take your little fingers and just come right above that little sternum notch that you feel there and pull up slightly, very gently, and release. And pull up. So we're going in this direction now. We're pulling up and release. And pull up and release. And pull up and release, and pull up and release. We're going to pause and come back to the breathing. So inhale and exhale, and inhale and exhale, and coming back above the collarbone, pulling up and release, and pulling up and release, and pulling up and release, and pulling up and release. One more time, pulling up and release, and pulling up and release, and pulling up and release. Okay, so coming to the top of the shoulders. This time we're just going to pull the tissue forward, so this direction, coming out this way. Just slightly pull, 1 and release, 2 and release, 3 and release. Good. And starting again, 1 and release, 2 and release, 3 and release. So for some of you, you may still have lymph nodes in the underarm, so we're just going to cup our hand under here and we're just going to pull the tissue this direction, like away from the armpit, just very slightly, really no pressure. We're just kind of trying to pull the skin to the side. Good. And now we're going to work in this direction, going kind of up and down, up and down, up and down. Good. So now we're just going to cup that entire underarm if you can. Some of you may not be able to move your arm at all because there's restrictions, so you could place your arm where you can and just fit it under there. And imagine that you have like a little wobbly board and you're just going in all 4 directions, like your hand, so there's barely going to be any pressure on there. It's just going to help move the fluid around. So create your little wobbly board in all different directions, moving under the armpit. And there's really no right or wrong way to do this. As long as you're moving and not placing too much pressure on there, it's going to help to move the fluid. So once you've done that, now we want to start with the arm open. So this time we're going to create a downward drag of the tissue and then looping up like a J. So you're pretending like you're drawing a J. So it's going to come pull and around and release. 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 And coming down pull and around and release. So now you're going to work around the outside of the shoulder. So pull down and around and release. Pull down, around and release. Pull down, around and release. Pull down, around and release. And come around to the back of the arm, pull down, around and release. 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 And then just lightly, just little tiny fingertips, very light. It might also almost like tickle you just around there. So we're just clearing that out. Good. Coming back to underneath the chest. Pull down, release, pull down, release, pull down, release. Good. Pull up, release, pull up, release, pull up, release, and pause for breathing. So inhale and exhale. Okay, so coming to the lower arm. So again, pulling down and then creating that little J. So we're working this direction and then looping it back up like as if we're tracing a J. So down, around and release, down, around and release, down, around and release. And while you're doing this, you may start to feel some tingling or burning, and that's a good sign. That means that things are starting to flow and move out of the area. Okay, so from here, we're going to turn the arm over and do the back side. So pull down, around, and release. 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 Down, around, and release. And then those tiny little strokes up towards the elbow, around the whole entire forearm. Good. We can rotate our wrists around. Perfect. Good. So from here, we're going to stand up and do a little bit of movement. I do recommend 5 to 10 minutes a day of some sort of just dancing, like full body movement that makes you feel good and that gets everything moving. So I'm just going to adjust the camera so you can see what I'm doing. Okay. So from here, we're going to do body shimmies. Actually, that's not, I think I'll lower it down a little bit. Okay, anyways, let me just back up. Okay, so from here, we are going to start with bending our right knee and bend your left knee. So as you see this, your hips are shifting from side to side. So you kind of get the idea. We're going to be doing a little bit of a shimmy. So right knee out, left knee out, right knee out, left knee out. So pick up the pace a little bit. Right, left, right, left, right, left, right, left. And now just kind of let it go. So you're doing a full like shimmy. You start to feel everything in your body vibrating and stop. Okay, so coming back to the belly, take a deep inhale and exhale. So let's start again. Bend the right knee, left knee, right knee, left knee. Pick it up a little bit, right, left, and now just let them kind of just flow back and forth. And now we're going to add the arms. So we're going to inhale the arms up. And it's okay if you ended up stopping and you're having a hard time focusing. This is a really hard thing to do, to coordinate your knees moving and your legs. So this is a little bit of a belly dancing move that I picked up along my ways of things that I've done in the past. So again, so let's bend the right knee, left knee, left knee, and then just kind of pick up the pace. Let your hips just go loose. Feel everything kind of jiggling in the body. Inhale the arms. Exhale and release them down. Okay, so now we're going to move into the shoulder. So we're going to hike that right shoulder up towards our ear. And you may not be able to do this because you might have some stiffness and you're stuck in the armpits. And that's okay. Just do the best you can. As long as you're producing some movement in the body, that's all that matters. So bringing the right shoulder up to the ear and the right elbow and the wrist. And then imagine that you have a wall right next to you and you're sweeping your hand down that wall. moving to the left shoulder to the ear, left elbow, left wrist, and then slide it down the wall. Good. So right shoulder, right elbow, right wrist. You got the idea. So switch to the side, left shoulder, left elbow, left wrist, and then right side. Bring it up. Just creating a nice little movement, and then just let your arms just kind of wiggle back and forth. Good. So now we're just going to put all of that together. So we're going to start with the right knee, left knee, just kind of move, and then add the right shoulder in, left shoulder, and then just kind of shimmy. And again, it doesn't matter what you look like, we're just creating movement in the body. We want 5 to 10 minutes of movement, so you can try to do these exercises or incorporate your own, whatever that you feel like doing that makes you feel good. So I hope that this was helpful. If you have any questions or comments, leave them down below, and I look forward to hearing from you. Have a great day.